Hi everyone and welcome to episode 5 of season 2. We are back with a really cool topic today, which we kind of touched on a couple of episodes ago, but we really wanted to do a deep dive in it today.
Yes, hey guys, and welcome back to the Brown Girls Guide. So like Kelly said, today's topic is a really cool one, and we're going to get really, into the nitty-gritty of this topic, which we are very excited for. But before we get there, let's just chat about what we are drinking today. Kelly, do you want to go first?
I will go first. I am drinking a glass of Shiraz. Is that how you pronounce it? Shiraz.
Who even knows?
I'm drinking a glass. It's actually more like a goblet because I bought these really fancy glasses recently.
Oh.
So it's imagine a Game of Thrones vibe. So I'm drinking a glass of Shiraz. It's a B&W. I thought I would remember the name of the farm, but I don't. It's not black and white. It's like someone's surname and another person's surname. A white man and a white man and a glass of Shiraz, which I'm really enjoying. What are you drinking?
That's good enough for me. I'm having a mojito, but instead of white rum, I've got gin in there, which I feel tastes basically the same. I don't know the brand because this bottle was gifted to me.
Okay, that's fine.
But yeah, so I'm having a nice fresh mojito, which doesn't make sense because it's flipping cold today. But yeah, I'm having some nice fresh mint with it as well.
Cool. It sounds refreshing. I mean, sure, on this cold day, but what ifs? As whatever you want to do for yourself. But let me just take the time now quickly to introduce our guest, who is Nicole. Nicole is a doctor. I know we just had a doctor on recently, but we really wanted to actually touch base with another doctor and then also just unpack a few things that we really want to talk about. Nicole, how are you, first of all? And welcome to our show. And are you drinking anything this evening?
Hi guys, thanks so much for having me. I really appreciate the invite and the time that you guys are taking to be here with me or me be with you. I'm actually drinking something. I'm drinking a gin and tonic. First one for the day. It's a single. Yeah, Blind Tiger and Fitch and Leeds sugar-free tonic just to keep it healthy.
Well, you fit right in. Cool.
Thanks so much for having me. Yeah.
No problem. Well, thank you for joining us and for being just so eager to actually chat to us. We're really looking forward to having this conversation with you. So let's kick off.
So because Nicole, I've just met you for the first time. You are Kelly's cousin for those who do not know. Do you mind just telling us a bit about yourself? We know you're a medical doctor, but can you just give us a brief summary of who you are and what you do?
Sure. So I'm Nicole Lodewyks. I am currently working at a government clinic in the Western Cape area, and I studied at the University of Stellenbosch. I did my internship in the Eastern Cape, amazing province, in Uitenhage, such a sweet town. People there are so lovely. And then I came back
to
Uitenhage. Yeah.
Is that what you say? Is that how you pronounce it?
You got me. That's exactly what it is.
No. Wait. Before we go further, what is the actual pronunciation of?
It's either or.
Oh, okay.
Yeah, it's either or. It's like if you're speaking English, it's Uitenhage, and then it's Uitenhage if it's Afrikaans.
Okay. Sorry, I interrupted you. As you did your internship in Uitenhage.
Yes, and my community service, I came back to the Western Cape. I was at 2 clinics here, and then I got permanently employed at the clinic, and I'm very happy to be there. And now I'm just a doctor chilling and living it up in the Western Cape, which is amazing, and I can't complain.
Awesome. Can I ask where you're based in terms of the clinic?
I'm based in Dunoon, CHC, so that's close to Bloberg. A lot of people don't know where that is, but it's close to Bloberg. Yeah.
I lived literally across the road from Dunoon. I lived in Richwood.
Oh, amazing. It's quite a nice area. Richwood's amazing. Yeah.
Yeah, it is a nice area. But yeah, Dunoon is massive.
And it's getting bigger. It's growing.
It must come with its own. Is there one clinic that services the whole area?
Yes. So it is one clinic. It's actually it's not a new area, but it's sort of newer than sort of Kailicha and Cooks and those places. The clinic was initially in the township itself, but then they moved it out to the industrial area. But it does service the clinic, and it's the Dunoon community, but also Milnerton and Tableview, Bloberg.
That's a big spread for one clinic. You must see your fair share of issues and hectic days.
Yeah, interesting things, but it's our community is really lovely. I can't complain. The people that we have, they're quite appreciative, and they're still very kind. Yeah, very kind people.
That's awesome to hear. Let's just jump straight into a deep question, should I say? So what are your thoughts on the state of women's health in South Africa?
I must say I can't speak on the whole of South Africa. I feel like throughout the different provinces, it's quite different. Coming from Eastern Cape and Western Cape, like we are known as the land of milk and honey in terms of medical services provided for South Africa, and we manage our systems very well. So in terms of Western Cape, I actually think we're doing very, very well. Women's health is actually spread across a very broad spectrum. So it's from the woman that's sort of entering like from teenage years into their 20s, and then it's the gynecological problems. So that's all problems related to women. That's not when they're pregnant kind of a thing. And then there's women's health that is then when the woman is pregnant and throughout the pregnancy and then just afterwards, which is the maternity sector. So I think we actually do very well in the Western Cape. In terms of public health, we have services at the clinics that's related to contraception, and that ranges from a little bit of preaching of abstinence to condoms, to IUCDs, to implants, and then if they want sterilization, we refer them on. If they have any gynecological problems, if they're needing pap smears and things, we see to that there. If they need further care, we also refer them on. And in terms of any questions related to sexual health, acute or long-term, we also advise them and refer them on if necessary. The hospitals are fantastic. They have their own gynae outpatient departments, and those are run by people that are actually studying to be gynecologists, obstetricians and gynecologists. So they are actually required to know quite a lot of information surrounding gynecological problems, and they are there to help the communities, and they do it quite well. They're also inundated with basically referrals from everywhere, but they do very well. And then in terms of our maternity cases, so we have maternity obstetric units. I'm sure you know of Mowbray, MOU, and those places. Yeah, but normally at every CHC, which is a community health center or clinic, there's an antenatal care part of it, which is sort of like when they are pregnant from the first trimester through to the third trimester. And then the MOUs are sort of where they deliver. And those are actually all run by midwives, which are really just fantastic sisters that are trained specifically for the pregnant female and delivery of a baby and placenta and like breastfeeding and things. And then if there are complications, they are then referred on to the secondary and tertiary hospitals, where there are also midwives, but then there's obviously doctors that if people need further care and complicated cases, they are then taken care of. So we actually do very well in the Western Cape in terms of our numbers of deliveries and safety thereof. And I think, like in my community, there's actually a lot of people that come from other countries, and they come here sort of knowing that it's a safe environment to be pregnant in and to deliver in, which is sort of like a pat on our shoulder. And then there's also the private sector, which I think does very well generally, but they're just very costly. I'm not sure if you guys...
We know.
It's not cheap. And like without medical aid, I don't actually know anyone's doing it. Even with medical aid, like it's still expensive.
Even with 100% cover, it's not 100% cover because you get charged 20% or whatever it is.
It's quite insane actually what the private costing is. And then there's this like in-between sector, which I think is actually quite nice. So there's like clicks or different like MChems and those things. And they also do things like contraception and like the injectables and things like that. And then there's something called, I'm not sure if you guys know about it, Maristopes.
Yeah. Love Maristopes, yeah. Am I saying it wrong?
I'm actually not sure. MARIE, I don't know. But they're fantastic. And they, in Rondebosch, close to or opposite Red Cross Hospital. And you can contact them on like a toll-free number. And they actually then phone you and speak to you about what you need and set up the date and the time. The payment is also minimal. I've been there for myself for contraception and things, and they're quite dedicated, they're quite keen, they're quite friendly. It's also female staff. You just feel more comfortable maybe with like a female person, and they'll talk to you about anything from abortion to contraception to HIV testing. Yeah, they're quite a fantastic service. So I think we're actually quite well stocked in the Western Cape in terms of where we can go.
That's so nice to hear, especially when it comes like in reference to the public clinics and hospitals.
It's quite encouraging to hear, yeah.
It is encouraging to hear because like you often, I mean, it might just be that we live this like completely sheltered life, but you often believe that the public hospitals and the public clinics are a mess, or they are like, or things are just going wrong, and it's just actually not nice. But it's actually really encouraging to hear that it is a safe space. I mean, it's easy for us to say because, as you say, in the Western Cape, we are actually seen as a really good city in terms of our healthcare services. So it's, I mean, obviously, like, we are in a position of privilege where we can say it's really nice to hear that. But I wanted to just quickly ask about the clinics. Is that open to anyone?
Yes, the answer to that question is yes. Anyone coming from a background of earning large amounts of money to someone that's earning nothing at all can walk into the clinic and receive free medical health care related to their needs of contraception. The only thing is it does operate within a time limit. So like we 8 till 4:30. So if you come at like 3:30 in the afternoon, we'll help you as far as we can, but we'll probably book you an appointment for the next available time, which won't be more than a week normally for family planning. And if they aren't able to help you, they have a plan to help you. Sorry, I'm not sure if I'm talking too much. You guys are
No.
Oh.
It's so interesting. Now carry on.
Yeah.
But I did not actually know what a clinic was. Like I didn't know where my closest clinic was growing up because we always went to private doctors, But just working in the clinic environment, it actually opened my eyes to what is available and almost that it's actually such a fantastic service and we almost don't have an excuse not to use them. It's just our own perceptions, I guess. I'm not sure.
I'm just thinking about it now. Like, I'm so used to going to private doctors my whole life because I just always had this actually very bad perspective that if I go to, like, they call it a dag hospital. Like, if you go to
Exactly.
if you don't go at like 4 a.m. in the morning, you're just never going to be attended to. There's just always been this reputation that, you're not going to be seen to and there's limited resources available. But it's so nice to know that there are so many things you can get advice on or medical health care for that I would even consider going to one now. I mean, I don't know where the closest one to me is, but it's really nice to hear from a doctor that works there that if you don't get seen to the same day, you will have an appointment. There will be some time for you to go because I think most people would just, suck it up and pay the 400-500 rand consultation fee for a private doctor because they don't know for sure that they're going to be assisted if they go to a government clinic.
No, 100%. I think we'll be lacking in that and maybe why people don't know is because advertisements of government clinics I haven't really seen them. It's sort of like word of mouth within the community. So I think unless you're part of that community and you don't have any other option, you sort of won't know that that's available maybe.
I'm just going to steer in a different direction. I know we've been focusing on mostly general health and sexual health, but I know what Ken and I are really interested in is just talking about, the menstrual cycle, menstrual health, period poverty. And just to touch back on what we said earlier, it is so encouraging to hear about how the government clinics are working to help anybody and everybody. What are your general thoughts around period poverty? Is it something that you encounter often? Or what do you think is something that the average person can do to help?
It's something that I've definitely thought of before. Before medicine, I was like, but what do homeless people do? How are they affording pads and things, Throughout my time of being a doctor, I actually haven't seen too many different things, but I have seen that people oftentimes, instead of using pads, they use other things like cloths and things that they can wash out, which I guess is not the most hygienic thing. And then I've read up about it, and it's actually quite interesting. There was a study done, I think, in Stellenbosch, where they said 30% of girls sort of miss school because of their period and because of the lack of sanitary pads and the embarrassment of actually having their period, I think. And I think that's quite shocking because I think they miss out on school, one. So they put it at a disadvantage for something that they can't help. It's biologically normal to sort of have your period. And you're missing out on school, which is somewhere where you learn and somewhere where you can build yourself up and just educate yourself enough to sort of progress in life. And then it also puts the males at a bit of an advantage. But anyway.
Let's unpack that. I'm joking. Let's not. That could be all night.
And then also, it's an American figure, but I think the American figure was that on average for a woman, starting with their menses at 13, they pay an average of 200,000 rand throughout their lifetime for sanitary towels and tampons and things. That's their number, which is, I think ours might be less, but I mean, we're also not as high earning as them. So that's insane, to put that amount of money towards something that's sort of you can't really help. But I'm not sure in terms of like we as government clinics, we don't have anything to counter that. There are people that donate things to us and we push that forward if the need is there. But I did find, I think it's menstruationfoundation.za. They're on Instagram, Facebook, and Twitter, and you can donate to them money or I think sanitary towels, and they are an organization specific to sort of distribute the funds as they see fit. Yeah, but I was quite shocked at that number of 30% of girls missing school.
That's very high.
I saw, I think it's I want to say KZN. Either KZN or the Eastern Cape. I'm getting my provinces confused. But one of those provinces have actually, the Department of Education, I think, or is it Department of, or maybe it's a combination of the two, the Department of Education and the Department of Health, are issuing like free sanitary pads to school-going girls.
I mean, that's like the bare minimum. I also wanted to ask, do these government clinics issue people free sanitary like products or no?
No, we do not.
My word.
No.
I mean, we give out condoms for free.
Like they should also be giving out pads for free.
In like every second bathroom, there's a condom dispenser. Okay, not every second bathroom, but I don't know which bathrooms I'm going to. But yeah. But you know what I mean? Like there are these condom dispensers that have like those the blue wrapped ones with, I can't remember what the saying is.
With the yellow.
Yeah, with the yellow on
there. I want to say
something
choppy.
about like choice or I don't know. Like, I can't remember.
Choice.
So I just want to have a bragging moment. So we have condoms at our clinic, and we actually have like the normal one, and then we also have 3 different ones. There's a grape scented one, strawberry scented one, and a banana scented one.
Like, how do you pitch these to like the people who come in? You be like, we have these condoms, but if you prefer a fruity flavor, you can choose or scent whatever.
So basically they come in different, the packets are different colors, and it's actually quite like exciting colors, very like bright yellow, bright pink, and like a nice purple. People actually get quite attracted by the colors, and they take it in accordance to that.
Sure.
Yeah, I'm sure it's the color.
Just while we're speaking about sanitary products, not the sexual products, sanitary products. Something I actually remembered the other day because I happened to look up something to do with ShopRite. Like ShopRite sells a pack of sanitary pads for R5. They actually have been going on a massive drive to actually sell a lot of stuff for just R5. Their loaf of brown bread, the uncut loaf, is R5. They have like daily meals for R5, and then they've got this pack of sanitary pads also for R5. So anyone that only has a R5 or anyone who has like R5 in excess and could afford to donate a couple of sanitary pads, ShopRite has got you. I think that is an excellent thing that they are doing. So anyone who has R5, ShopRite has a pack of sanitary pads.
That is.
And I mean, it's nice to maybe just buy a couple of extra packets to just keep with you.
Yeah.
And when you come across someone who needs them, you can just give it to them.
You can donate it to a school, or there are people who do these sanitary drives where they will ask you to drop off pads or tampons or whatever.
Yeah, there's also like at the clinics, there's generally someone dedicated normally that you can donate to. So if you are if a school, you're thinking like a school and you're like, oh no, there's 30 kids, I can't donate that much. You can always donate to the clinic, and the social worker there or someone that is there normally is able to distribute it. And as local NGOs as well. And I think they'll also do well with those kinds of products.
Awesome. Let me move on to the next question. What would you say are the top issues that women are facing with regards to their health right now?
Top issues facing females health-wise, I actually think is still contraception and definitely abortion, and also just cultural norms that people are following, and it's sort of not coinciding with like gender or female health.
No,
that's my idea. There is a sort of perception, like in terms of contraceptives, that people are hesitant to go on them, especially hormonal ones. Like, what is your experience in, dealing with people who come in and want to talk about, birth control or, want to like family plan?
So it's quite a difficult thing, but I'm not sure how it was for you guys at school. For us at school, it was known, but it wasn't spoken about as in you'd actually go for an injection at the age of like
Same.
15
Same,
or
yeah.
take the pill. You're sort of like frowned upon by your family. You're like, why are you taking the pill? No, she's sexually active. That's a no-no, kind of.
It's just such a no-no.
Such a no-no. Like
Yeah.
I actually, sorry to jump in, but like when I was in grade 8 or grade 9, I had really, really bad periods growing up when I was a teenager. And I went to the gynecologist and he actually said that because I'm prone to cysts. They're not really harmful, but they just cause a lot of pain on my period. And he said the best thing would be for me to go on the pill. And my mother was like, no, there's no way she's going on. So I actually only managed to go on once I turned 18. But so I just had to live with like these really bad periods.
Sorry, that's terrible.
I was going to say, your mother's listening to this podcast.
Sorry, mother. But yeah, so I had to just deal with the period pains. And I think, yeah, a lot of people culturally will be like, oh, she's fast. Why is this young girl on birth control? You know?
I hate that. Oh, she's anyway, that's a different. also a different thing.
No, but it ties in as to the reasons why girls don't then come for contraception when, even if they are fast or they are having like sexual relations with people at that age, they still then should even more so be on some form of contraception to prevent an unwanted pregnancy.
Yeah, I think shame has a lot to do with it. Like, it just wasn't a thing. And also there was so much like shaming happening. So like if a girl like, and I feel ashamed. Oh, how many times can I use the word shame in the sentence?
Let's see.
I feel ashamed, like even just thinking about it. But you would say things like, if a girl is like, if she's like putting on weight, you'd say like, oh no, she must be on the pill, which means she must be sexually active. She must be having
Yeah.
And then all of a sudden, like it's Skinner, and you like, and it's actually disgusting. There was a lot of that happening, which means that as young women at the time, as girls, learning about all these things, we were ashamed to even talk about it or ask for it. And as you said, Amber, like you actually needed it for a medical reason. And it was just like so taboo, and it was like so no.
That's why I say like the cultural norms is an issue that's facing females as well. Because I think as much as Cape Town itself is quite westernized, we still rule by the cultures that are and, coming from religion or cultures of people coming from a different province or a different country. It's almost like you can have sex as long as nobody knows about it. And even at the clinic, we have like young girls coming in their school uniform and things. And it's actually a service specific for the youth that we began to focus on, I think, 2 or 3 years ago, because they are a vulnerable population. And we sort of tried to create a safer space for them to come and actually ask for these kinds of services. But you're still fighting cultural norms, because, I mean, when they come home late from school, their moms are going to ask where they were. So now they have to lie about where they were, which is also not good, because they can't say they went to the clinic for contraception, because then the mom's going to be like, what do you need that for?
It's such a hush thing.
Yeah, exactly.
Like I know people, I won't say their relation to me because I don't want to, rat anyone out, even though we're all so old now. But I mean, even in high school, people that I was close to had to like lie and say they were like at a practice or somewhere else, and they actually were meeting with like a trusted auntie or someone to just go on contraceptives. And I think, sorry that I'm just like rambling now, but it just makes me think about, young people that are sexually active, and, things like STDs are very real. And when you're young and you're too scared to even just go to a doctor to go on the pill, imagine how ashamed you feel when you get an STD, which is a very real consequence of having sex. You are too scared to go have it checked out, too scared to have, just any sort of interaction with someone at a clinic because you feel embarrassed about it. And if these things are left, I mean, they only get worse if they are untreated. This whole thing around shame it's something that needs to be changed, but I don't even know how to begin.
I think I must say, even though there's a lot more work to do, I think it has obviously improved in terms of just education. But I think there's some step that we're missing from education to taking that education and like making it a practice. Like I'm sure at their schools they preached about in terms of condoms and STDs and things, but then to actually take that home and be like, oh, I have an STD and now I can go to the clinic and actually do something about it. Like, I don't know, there's some step that I feel like we're missing, and I don't know how to normalize it. I don't know if it's talking about it more openly or if it's education or,
Amber, I'm going to leave the next question to you.
Sorry, before we move on, I just wanted to mention with abortion, sorry, we
Yeah, go
I
for
touched
it.
on that minimally, but I just want to say that if there are any people that are listening and they want to know more about abortion, wherever you go, if it's to a GP practice or to a gynecologist or to a clinic or to Mari Stopes who do provide that service, and that person is not able to help you because of their models or their stance on it, they also they have to refer you to a place, or they have to like tell you about the place that does do it so that you are able to exercise that right, because it is your right to decide what to do with your body. I'm just saying.
I've actually
So,
heard about one person who was pregnant and did not want to be pregnant any longer, and their GP actually said that they would not assist them because of their models. And I didn't know that you are able to say, like, well, you have to refer me somewhere. I didn't know that that was an
Yeah,
option. So that's
yeah,
very good
they
to
have
know.
to. And you as the client are allowed to insist on a referral.
that is
And I
very
think
good.
now that we're on abortions, this is something I feel strongly about. I haven't had one, but I've seen a lot of people go through a situation like this where you fall pregnant and you don't want to be pregnant. And then a lot of people think there's always a hefty cost involved, but that's not always the case. If you go to your local, government clinic, you will be assisted. And,
Yes,
I don't want to give too much away. Maybe I'll just stop there. But I mean, you can definitely go to your nearest government clinic and you will be helped. And more often than not, the people are so welcoming and so friendly. And it's not something that you need to feel shy about or ashamed of. Because I remember this is something Dr. Layla mentioned when she was on, is that someone is providing a service to you. So you don't have to feel like you can't ask certain questions or you can't come to them with anything you want to talk about. You are there for
exactly.
a service. Anyway, so my next question, I don't know if, okay, we'll just change gears. So as a doctor, what are maybe like the top 3 things you think we should be focusing on as women when it comes to our health? Like I know sexual health and periods are what we like focus on mainly, but what would you advise we should be keeping like an eye on in our day to day to make sure our health stays, in tip top shape?
That is a very good question. I think it's the one aspect of it is just to sort of take time to understand yourself and what you want within a relationship. I know that sounds very maybe wishy-washy and very broad, but I think once you understand that, a lot of other things fall into place. So if you understand that you want 2 kids at the age of 30, but maybe you're sexually active before that, then obviously you're going to need to use contraception. So you need to make decisions on like what contraception you need to use. I think probably the type of contraception that you do use is one of the most important things for you. And then just to talk yourself through, let's see, what would happen if you fall pregnant and those kinds of scenarios. So I guess your focus would have to be on yourself, decision about contraception, and then those are 2 things. I can't think of the third thing. I must say, I also think, sorry, this is now I'm
No, it's
digressing.
fine.
I think female health also extends to just general health. So, like your weight and those kinds of things, like mental health and things like that. I think it's very key for us as females to check in on those things because it affects us later in life as well.
Just on women's health. So I've read like a couple of articles where women's health, and especially for women of color, their health is not prioritized as much. And there are a lot of issues when it comes to the healthcare system and how it works against women in many ways. Do you
Okay.
think this is the case in South Africa?
Once again, I can't answer for the whole of South Africa, but I can maybe to a degree answer for my ideas around the Western Cape. I think we actually do quite well. I think we have quite a lot of private guys like obs and gynae guys that service populations. We also have Mari Stopes in between, and then the government clinics. I think we do quite well. The only thing we fall short on, and I think it has a knock-on effect, and I'll explain now, but basically the clinic that I'm at is already has its structures in place. We are so many set doctors, and the resources in that frame doesn't grow, but the community keeps growing. So you'll have, obviously, because the community keeps growing, you'll have more females over time and you'll have more people to service. And we take strain in the sense that we aren't adding on to our numbers in terms of staff members. And the only way then to cater for that is then to decrease the amount of time that you spend with each client. That can have a knock-on effect in terms of then you giving them sort of less education, you're sort of hurrying through the consultation, and then maybe they're making not as good as this decisions, that they could be making had they had more time, more patience in the consultation. They could have maybe asked more questions and things like that. The one other thing that we maybe fall short on is the language barrier.
Oh,
So
that's true.
obviously our medical studies and things, it's done in English, and then we are taught maybe a little bit of Sikos and Zulu, but maybe you get a Sotho patient and she can't actually speak any English, but there's no one around to sort of translate for you. We do have a telephonic service, but we aren't excited when we need to use it because things get lost in translation and things like that. For like educational things where you actually need to like speak through proper sentences, it's so tough. Like, how are you going to explain an implanon and then the hormonal factors surrounding that? And yeah, it gets quite difficult and intricate, I guess.
I'm just thinking about how we mentioned earlier that, in school, we don't get a lot of education around, sexual health and those kind of things. Like, I mean, they definitely shove HIV down your throat. Like, that's for sure. I think my age group was the first to get, the full-on education around it and like, do not have sex, you will die kind of thing.
Exactly.
that was basically the messaging. That's really yes.
Basically, like memories of primary school is just that red ribbon everywhere. So very little was spoken about in terms of, other issues about sexual health, like, STDs, abortions. What do you do when you need an abortion? And there was very, very little education around it. It was just, the main message was just abstinence. And that is not, like I said earlier, a realistic way to learn about it. What do you think, without tackling, the whole education department, just on a broad level, what do you think are the realistic ways we can teach young people about sex and about being safe? Because just telling them to not do it is not realistic. Kids are curious, like it's going to happen regardless of what we say. What do you think are some realistic ways young people can be informed about, abortions and, safe ways to go about family planning, even at such a young age?
I actually think we need sort of like an in-between type of thing, not quite at school and not quite at the clinic, because it's two areas where like the sisters at the clinic, maybe they're scared of, and the teachers at the school, maybe they're scared of. You sort of need an in-between place that's almost like safe
a
neutral place, and with someone that's there basically known to support you, not to teach you, but to support you. So where education is given in sort of an area where you're sort of not scared to ask questions and the right information is given. So it's not like it's sort of said, you can do abortion in this way, A, B, and C, but don't do it because you shouldn't. It should almost be a thing of like just offering them information and having an open area where they can just sort of ask questions, an open platform. And if they so choose to do that, you guide them to that decision. Or not to that decision, but to get to the right ways.
What works for them.
Yeah, almost like a youth program, but not specific to church.
There's such a need for things like that, but like I always wonder, like, how do you do this? Like, do we need to do it in like a WhatsApp group? Because like what are kids responding? I say kids, or what are young adults responding to this?
I have no idea. I have no idea. And I think that's the other thing. You have to sort of meet them at their level. And I'm not sure if the internet and I feel like the internet, it opens a lot of avenues because it can teach you a lot, but are they actually asking the right questions on the internet? And does the internet within South Africa have the answers? So if you type in, where can I get an abortion? I don't know if that's like a question. Will the right answers come up? I'm sure Marie Stopes will come up, but then maybe they don't have access in terms of money and transport to get there. So then will anything else come up?
Because when you Google, where do I get an abortion, Marie Stopes is the first one that pops up. And I think you mentioned earlier, like there's such little government advertising about the services offered by the clinics that if you Google, sexual health things, the government clinics hardly ever pop up.
Yeah.
If I Google like, oh, I need to get a pap smear or something, like I also inquired with Marie Stopes because they were like the number one thing that popped up. Not once as a government thing come up.
I think it also, and I mean, this is going to sound so ridiculous in the context of what we're talking about, but it comes down to the fact that the government probably just doesn't have money to spend on SEO.
That's true, actually.
It sounds like ridiculous, but it like probably is that like when they are looking at like their budget, no one is sitting there thinking, how can we get to the top of Google search rankings?
That's last on the list of priorities.
Which is weird because they kind of need to be there because people need to know. So maybe it's like up to someone else other people like us, even just to talk about them and as often as possible, because they're not going to come up in Google because they don't have I'm pretty sure they don't have that person in their department. So it would be up to like us regular people, I guess. So we will have this conversation.
Kelly, do you have any other questions you want to ask?
I am out of questions. I've learned so much. Thank you so much. And I think we just need to be aware of what we have and like spread the word.
Absolutely. And you've really helped us so much, Nicole, to learn about, what resources are available to us, even if you don't have a budget for healthcare. There are resources available to you. And I hope that, people take something from this when they find themselves in a pinch. It might not be related to sexual health, it might just be a general health query they have. You have that resource at your disposal. So that's amazing. Thank you so much.
Thank you guys so much for having me. It was a really good experience.
Well, thank you for joining so quickly because we did ask you very last minute.
Very last minute.
That wasn't too last minute. Thank you.
Thank you so much for joining us. We appreciate it. For anyone wanting to know more about things that we have discussed in this episode and want links to all the resources that we mentioned, we'll put the details on our social media pages. You can find us on Instagram and Facebook at Brown Girls Guide Pod and on Twitter at BGG Pod. And if you just want to drop us an email and say hi and whatever it is you want to say, you can do that on info@browngirlsguide.co.za. And that is all from us. Nicole, thank you again for joining us.
Okay. Thank you so much.
Thank you.
So thanks everybody for listening and we'll chat again next week.
Thanks guys. Bye.
Bye.